Hello and welcome to QOF 400 screencasts. In this episode, we'll be discussing the stroke and transient ischemic attack templates. Based on our test patient, we will go ahead and launch the template. We are now presented with a number of options. The first section is relevant to the diagnostic terms of stroke and or TIA. As you can see here, you have the option to evoke the QOF codes for stroke or TIA, one or the other, stroke and TIA both together, and TIA alone. For those patients who are not suitable or dissent their TIA/stroke diagnostic terms, you have the ability to accept code them right here. Furthermore, you have the ability to enter the MRI or the CT scan findings that led to the diagnosis of the TIA and or the stroke. Of course, blood pressure measurement is very important, but this can be extracted from the patient record itself. Furthermore, smoking status is also important in this case, and if and when the patient is found out to be a smoker, of course, please make sure that you provide the smoking cessation advice accordingly. The rest of the template is relevant to the secondary elements relevant to the stroke and or TIA, and that basically is the blood pressure and the cholesterol level. Furthermore, with stroke and or TIA patients, the stroke review tab provides you with views regarding the TIA and or stroke of this patient, and these are already extracted from the patient record themselves, where you don't have to make any significant contribution here. However, for those who suffer with stroke and or TIA, it is important that you pay attention to the flu vaccination status of these patients. Finally, if there are any contraindications to the prescribing for the TIA and or stroke for these patients, these can be documented in this section. Otherwise, any prescribing practices can be documented in this section. And may I please remind you that over-the-counter aspirin purchases can be also documented here, which is a very important and all too often forgotten aspect. Finally, for those who are interested in finding out further about the rule sets governing the stroke and or TIA for the QOF, these can be found here. I hope this has been a brief and useful review of the stroke and or TIA template for the QOF framework. Thank you.